Hey everyone, welcome back to Alpha Street Interviews. This is Arjun Vijay, and I have with me today Suren Ajjarapu, who's the CEO of Trxade Health. Trxade is a Nasdaq-listed health services IT company with the ticker symbol MEDS. Hey Suren, good morning. Great to catch up with you again.
Hey, good morning, Arjun.
Suren, let's start with a quick bio about the company for people who are not familiar with it. Can you just briefly tell us about that?
Sure. Trxade is all about a market platform that caters to the independent pharmacies and that have no purchasing power and the cash flows issues or negative reimbursement. So those are the three problems that we try to address. And as my partner and I used to own independent pharmacies, we went through these three problems. First, because whatever I buy from 1 to 15, I have to pay by the 7th business day to the big wholesalers while I'm waiting for my reimbursement to come. That's one cash flow issue. Two, sometimes that prescription can be dispensed at a loss. So that's a negative reimbursement. That's a secondary. And finally, the third problem is supply chain issues that are not readily available, that information when compared to the big box chains that have millions of dollars worth of IT systems that our independent pharmacist doesn't have the bandwidth or the resources to spend in the IT. That's the empowerment that Trxade provides them, providing the information that is necessary and useful for them so that they can sustain in the long term in a profitable way.
Okay, great. Now, earlier this week, you reported your Q3 results, and we know that there was a year-over-year decline in revenues because of the PP sales last year. But interestingly, there was a 34% sequential increase in revenues in Q3. Now, what really contributed to the sequential growth?
Our platform is growing, as you are aware, that we've added 250 new independent pharmacies that we've added. That's one thing. And the second is the per wallet share per month is also increasing because, as you are aware, the independent pharmacy that does 3 to 3.5 million annual revenues have a purchasing power of $250,000 to $300,000 at this time, and they may be doing 4,000 to 5,000 per wallet per pharmacy per month. That's what the exponential growth we are all focusing, that per wallet share per month, and that is increasing. So those are the two areas that has contributed to the growth of sequential growth. And that's the reason you see in our gross margin also increased because of our platform revenues.
Suren, you had recently targeted non-pharmacies also to add to your Trxade platform, right? So when you say you added 250 new registered members, what can you tell us about the mix of pharmacy to non-pharmacy additions? Where do you see a higher pace of growth?
Still the pharmacies, probably I would consider 90% of that is the independent pharmacies, so only 10% on the clinical side of it, or clinics, podiatrists and stuff. But there is we've identified almost 30 to 50,000 of these clinics that has a similar problem like independent pharmacies has, like I'm throwing an example, podiatrists or dentists or ophthalmologists, and these are the only, again, a single doctor, maybe a nurse helping to do the procurement of these drugs. So those are the areas that our focus is, these independent clinics, not the big hospital chains, but they still have a single buyer, doesn't have the bandwidth or the resources to shop around. They don't even have the time to shop around, and that's where we thrive, and that we are keep on adding that segment. And we have not even peaked on the pharmacy side, as I mentioned. We are gathering the masses first, and then we are focusing on the per wallet share per month purchase.
All right, makes sense. Suren, during our last call, you spoke about how the rise in COVID cases in India and China was affecting your supply of generics. How has the situation evolved since then?
It's a global supply chain is the biggest issue, as you're aware. Even in US, if you've gone through the news, we have a big supply chain issues. And of course, President Biden actually initiated 24/7 for all the ports action. So even if we import these generics that are coming from India and China, has to come from Longboat Beach in California. So those supply chain issues will constantly be there, but that's where our platform thrives. If there is a supply disruptions are there, the patient cannot suffer. The independent pharmacies still need to serve these patients. As you're aware, indirectly, we're serving 15 to 17 million patients through over 12,950 independent pharmacies. So we need to cater to that, and that's how the Trxade thrive in those kind of supply chain disruption issues.
Okay, great. And your Bonum Health unit recently launched something interesting called Digital Telemedicine Passes. Tell us a bit about that.
It's an e-gift program. People can gift a telehealth to them, because especially the holiday season is coming. Even the employers are also looking to means and ways to give this digital health. So because as you're aware, I know granted most of the people are working because of the pandemic from home, people are still worried about, like, even if they have a slightest cough or a sneeze, they don't know whether it's a COVID or not. So they at least can talk to the doctor, get the tested or whatnot. So they have their results can be uploaded to the Bonum Health, and so that they can show around to the consumer. So that's where the e-gift card program is all about. And not only that, we're catering 50 million uninsured and underinsured patients. So there is also another gift of this gift of health is the way that the first in telemedicine world that we've launched Bonum Health, the e-gift card program, especially as I mentioned, I'm repeating again, Thanksgiving and Christmas time, everybody wants to gift it. And everybody wants to do something. What else is better than their good health? So that's where the e-gift card program is all about.
And what can you tell us about the financial impact of this specific product on your overall financials?
Sure, it's the same model. It's a $40 a gift card. We still have a $30 charge for the doctor, but it's our aim is the percentage utilization rate. But in this gift card, there is a definite, if they don't, it's a must. So it's the $10 per gift card we will be start making.
Okay.
So for an impact, like if I'm able to sell 100,000 gift cards, that's $1 million added to the bottom line.
And if I want to purchase a gift card, how do I do that?
Please visit bonumhealth.com, and there's on the right-hand corner, you see the e-gift card. So you can download then and there itself, the digital card. It will send you the digital code so that you can email that code to the people, or you can have a self-designed. If you like the Christmas card, Diwali, or whatever the cards that they have, they can pre-design those gift cards and send that gift cards to those loved ones.
All right, great. And Suren, what's the update on your partnership with GPOs, and when should we expect to see a material impact on your financials from these partnerships?
Sure, that's a great question, Arjun. We are, that's another reason why we see the growth in the GPOs. As our GPO program is nothing but that pharmacy buying 100% through our platform. And so to add that, you need to have a full breadth of the catalog and other items that each individual pharmacist look for. As you're aware, 2,000 to 3,000 SKUs that they carry. The $74 billion is only just a prescription drugs, but not only that, within the prescription, you have specialty controls and so on and so forth. So the platform has to address all the needs. That's where we are slow and steady growth that we're taking. Even if I have 10 pharmacies that are buying $300,000, that's a $3 million revenue increase per month, as we see. So to answer your question, probably towards the second quarter or third quarter, we'll try to see the impact of that GPO programs.
Okay, great. Just one last question, Suren. Again, during our last call, I hope you recall you had mentioned some of the headwinds facing the MedCheck's Health Passport product.
Sure.
How do you propose to take this product forward?
Yeah, as you're aware, even though the temporary fix for the MedChecks is only vaccination and COVID test results, but the end goal there for MedChecks is carrying each individual person their own health records. Right now, the US, most of our health records are stayed in the doctor's offices, doctor files. I know you may ask EMR, EHR, but still they're considered. I know you are aware of it. Recently, there was a ransom virus hit on a hospital. They will have to wait for 2 hours to get that system back. And doctors don't know whether the patient in that room, they don't even know what is his name. And they don't even know what services they have to make. So if the electronic health records are stuck in the doctor's offices of these EMRs, as a patient, don't have a control. So our goal is we want to empower the patient with their own health records so that they can take care of their own well-being. That's our goal, end goal. So not only that, we want to integrate with our Bonham Health. So if I'm talking to because the Bonham Health eventual goal is right now, of course, an emergency need and stuff, but we were extending that thing to remote monitoring patients and as well as the scheduling of their own doctor visits. So that way, if they have their own health records, whether it's a teledoc or whether it's their own doctor, when they're talking to them, they have their health records easily accessible so that they can diagnose the right medication and right therapy to the patient. So at the end, the bottom line is we want to empower the patient to carry their own health records so that they can cater to their own well-being.
Wonderful, makes sense. That's all I have for today, Suren. Thank you for your time and responses. We'll probably meet after the next earnings.
Okay. Thanks, Arjun. Take care. Be careful.